Hello, very good morning to one and all here. I am Dr. Lakshana. I am a consultant obstetrician and gynecologist practicing in Vasanta Hospitals, Tiruvattiur, Old Vashanpet. I am the proprietor of this hospital, and this hospital is located in Chennai, Tamil Nadu. So, coming to the topic of our day, the topic of our day today is GERD. GERD stands for gastroesophageal reflux disease. So, gastroesophageal reflux disease is a chronic gastrointestinal disorder which is characterized by the regurgitation of the gastric contents into the esophagus. So, there are several mechanisms which can cause GERD. It can be either intrinsic, that is in the body already, or it can be any structural abnormalities in the entire GI tract, or both of which, leading to the disruption of the normal esophagogastric junction, resulting in the exposure of esophagus to acidic gastric contents. So, the GERD typically manifests with two more common symptoms, which is heartburn and regurgitation, and it can also be present in an atypical patient with extra esophageal symptoms like chest pain, dental erosions, chronic cough, laryngitis, or asthma. So, for better understanding of GERD, I have a stomach model with me over here. So, this is how our stomach, our entire GI tract will look like. So, this junction here is the gastrophagoesophageal junction, and there is a sphincter which is present right over here in this junction, which is called as the lower esophageal sphincter. So, normally, what happens is the lower esophageal sphincter is closed at all times except when we are having a meal, or when we are swallowing, or when we are drinking water. So, the main function of this lower esophageal sphincter is it does not allow the contents from the stomach to regurgitate back into the esophagus. So, this is the normal protective and preventive mechanism which is there in our body. So, in case of GERD, what happens is the most common etiology is it can be some motor abnormalities like esophageal dysmotility, which causes impaired esophageal acid clearance, or there may be some impairment in the tone of the lower esophageal sphincter, or transient lower esophageal sphincter relaxation and delayed gastric emptying are all included in the causative factors of gastroesophageal reflux disease. Anatomical factors, there are two main factors. One is hiatal hernia and one more is obesity. The reason for obesity being the cause of GERD is, in case of obesity, intra-abdominal pressure is increased, so which is associated with an increased risk of developing gastroesophageal reflux disease. As we have already seen, the most common signs and clinical presentations of GERD is heartburn and regurgitation. However, GERD can sometimes be present with other symptoms like dysphagia, odynophagia, belching, epigastric pain, and nausea. So, when GERD is considered to be atypical, patients also present with chest pain, chronic cough, asthma, laryngitis, dental erosions, dysphonia, and hoarseness. So, the most common differential diagnosis for GERD is coronary artery disease, that is, any problems with the heart. So it is very essential to diagnose the clinical signs exactly. Otherwise, we may think the patient is having GERD and keep treating, and he might be undergoing silent heart attack. So a patient who is presenting to us with heartburn must be evaluated, must be advised an initial ECG, and all the heart problems to be ruled out. Only then it should be characterized as GERD. So, coming to the treatment part, what is the treatment for GERD? The lifestyle modifications are the cornerstone for any GERD therapy. So, the first thing is counseling. Counseling regarding what? Counseling regarding dietary modifications. So, if the patient is obese, we advise them to lose weight and bring the BMI in normal range. That is, no obesity and no overweight. And secondary thing is lifestyle modifications in terms of food. That is, food should be taken in normal moderate amounts. That is, you should not have an entire meal, a large course at a point of time. So we can advise the patients to have split meals, 4 to 6 times meals per day, with short meals each meal. and a minimum of 2.5 to 3 liters of intake per day is very essential, and spicy food should be avoided, and bedtime meals, that is at least 3 hours before the bedtime the meal should be completed, because once we are with the full meal and we lie down, the lower esophageal sphincter is very much relaxed, and that causes all the contents from the stomach to regurgitate into the esophagus. And secondary, why is it important? Because it can cause a significant amount of distress in everyday life. GERD can be ranging from non-severe to even severe complications in life. So managing GERD is very important. And regarding counseling, once we recommend the patient dietary loss and we have to keep the BMI in check, having 8 hours of sleep per day is also very essential, because it is shown that any disturbances in sleep are associated with the suppression of the tone of the lower esophageal sphincter, resulting in decreased reflex episodes. So it has also, studies have also shown that elevation of the head end of the bed has shown improvement in the GERD symptoms. So, what are the foods which can cause GERD? Is most commonly chocolates, caffeine, spicy foods, and citrus fruits like orange, and carbonated beverages, that is cool drinks. These are all better to eliminate if the patient is already known and he is suffering from GERD. So, after the dietary modifications, once the dietary modifications fail and the patient goes in for medical therapy, there are three types of medical therapy now available. The first one is antacids, which is like histamine or H2 receptor blockers like ranitidine and cimetidine. And the second one is proton pump inhibitors. Proton pump inhibitors, we have new various generations. The most commonly used ones nowadays are pantoprazole, omeprazole, esomeprazole, and lansoprazole has been recently launched, showing daily dosage is efficient, and it does not cause any recurrent GERD symptoms. And prokinetic agents like domperidone, their use is of doubt as of now, but antacids and PPIs are known to work excellently in case of GERD. So GERD we can classify into further three different types based on endoscopic and histopathologic appearance. The first one is non-erosive reflux disease, and the second one is erosive esophagitis, and the third one is Barrett's esophagus. So, why is it more essential to treat GERD and keep GERD symptoms under control? Is because of chronic reflex and because of the chronic irritation from the stomach contents which are acidic. For example, the hydrochloric acid and pepsin, and the duodenal contents like bile acids which are alkaline. They both tend to reflex back into the esophagus, disrupting the normal mucosal lining, which can result into cancer at a later stage of time. So even we see nowadays a lot of young adults coming in with GERD. So it is essential to give them counseling and not to take it lightly, because it can pose serious complications in the future life. And nowadays we see more youngsters who are using tobacco and alcohol and all. Advising the patients on tobacco cessation and alcohol cessation is also very important in GERD. And certain food substances has to be avoided in GERD. For example, high fat diet, and those are all to be totally avoided. For example, oily and spicy substances are to be totally avoided. Instead, they can opt for high fiber diet. Okay, so and coming to the protein rich diet, if the patients are not tolerant to the egg yolk, only the white part of the egg which has boiled to be taken. And even if we are going for meat for the protein sources, the way of preparation plays a very big role. Instead of frying it, shallow frying it, deep fry it with oil, if we go for baking or steaming or even tandoori with less of oil, all these cooking methods have shown great benefits in controlling GERD symptoms. So what we eat and how we eat, and the moderations we eat, and the preparation methods all play an important role in controlling the GERD symptoms.